Шановні колеги, дорогі друзі, радий вас вітати на черговій зустрічі, присвяченій Дню педіатра. Люди, які лікують дітей, вони є особливими. Треба знайти підхід не тільки до пацієнта, а і до їхніх батьків. Треба знайти той шлях до серця дитини, який дозволить надати їй ефективну медичну допомогу. Ми дуже раді, що ви не тільки лікуєте самі дітей, але й ділитеся своїми знаннями і вміннями з лікарями інших спеціальностей. Тому що сімейному лікарю також необхідні ці вкрай важливі навички. Я сподіваюся, що наша зустріч, незважаючи на постійні обстріли з боку Росії, відбудеться безпечно. Ми зможемо обговорити всі питання академічні і поспілкуватися поміж собою. Ну і, звичайно, ми дякуємо Збройним силам України за можливість продовжувати наше навчання і нашу роботу. Слава Україні!
Hello and welcome. Thank you so much for inviting me to address this very special conference. Some time ago, President Zelensky, your president, said that your victory is not far off. I heartfully believe in it. I also heartfully believe in Ukrainians' European future. Slava Ukraini. Hello and welcome to this very important conference, scientific and practical conference with international participation, Pediatrics Nowadays. It's my privilege and to be at the opening of the conference. My name is Hania Szajewska. I'm professor and chair of the Department of Pediatrics at the Medical University of Warsaw, Poland. And allow me to start with a starting quote, which comes from the Dean of Harvard Medical School. It was said more than 60 years ago, but it's still very true. Half of what you are taught as medical students will in 10 years have been shown to be wrong. And the trouble is, none of your teachers knows which half. That is why it's so important that we meet again and again and discuss new evidence, what is new, what is known, and what is new in medicine. Enjoy your meeting. It will be also my personal privilege to contribute to this conference with some pre-recorded sessions. First, on infant nutrition, but also with 2 EBM, evidence-based medicine sessions. First, on understanding randomized control trials, and also on understanding systematic reviews and meta-analysis. Once again, enjoy your meeting, and once again, Slava Ukraini. Thanks a lot.
So let's start our section. And first of all, I would like to introduce our referee team, and I would like to ask the chief of our referee, Professor Evgeny Rudenko, to say some words before we start. Also, the team of our referee, it is Associate Professor Olena Mozyrska and Assistant Professor Natalia Kiritsa. Please, Evgeny Olegovich, do you hear me? Okay, so please tell some words for our students before we start. Microphone, your microphone switch off. Microphone. Your microphone switch off. Микрофон. Не включен мікрофон.
Зліва в нижньому вуглу буде мікрофон включити.
Євгеній. Ні, знов вимкнено.
Перепрошую, ви знову вимкнули мікрофон. Включіть знову, будь ласка. Вас не чутно. О, вже
Okay.
да, чутно.
So, can you hear me now?
Yes, yes. Okay, thank you.
Thank you. Sorry for technical issues. This is a great pleasure and great honor to take part as a head of a jury in this conference. My greetings to all of participants, to colleagues and students that are going to present their talks, their presentations, and I hope these presentations will be perfect, and I think we will estimate them correctly, and I wish all participants to take the first place in this competition. So let's start our job and wish all the presenters to do their best to make this conference successful.
Thank you so much. Thank you so much. Some information for you and for your team. So you have a group in Telegram, and total marks who can receive every participants, it is 25. So referee will be check your level of your presentation, how you can make a report, what about technical aspects of presentation, and then we calculate the average of all marks, and at the end of our section we can know the place, and all participants who receive the diploma will know these results at the end of our section. So, and I would like to introduce our first participants. It is students of Bogomolets National Medical University. It is interesting topic. I know the students work very hard to prepare this message for us. And I would like to introduce Kalagi Patel and Banshi Kakadia. So it is a team of participants with reports, comparative study of medical guidelines of attention deficit hyperactivity disorders in children in India and Ukraine. So we have a recording message. So Kalagi, do you hear me? Hello?
Yes, doctor.
Yes, okay, very good. Banshi, do you hear me?
Yes, doctor.
Very good. So now we have a recording report, and then everyone can ask the question for our participants. So let's start to see.
Hello everyone, myself Bansi Kakalia and my co-author Kalki Kamesh Kumar Patel. We are going to deliver a session about the comparative study of medical guidelines of attention deficit hyperactivity disorder in children in India and Ukraine. We're studying in Bogomolets National Medical University, Kyiv, and our scientific advisor is Anna Yunitsurenko, PhD Associate Professor, Pediatrics Department number 4. To speak about the introduction, ADHD is a neurodevelopmental disorder in children which has a pathological basis, including substance use, brain injury, and several other factors. It can have a significant impact on individuals' lives and disrupt their school, work, family life, personal life, etc. It can also lead to other significant comorbidities such as ASD, ODD, and CD. So in this presentation, we're going to provide what % of children are suffering from ADHD in Ukraine and India. And we aim to disparities in assessment and management of diagnosis and treatment for ADHD in both countries.
So talking about the aim of study and methods and materials, Our aim is to compare the medical guidelines of attention deficit hyperactivity disorder based on the review of the literature with the focus of its diagnosis and treatment in India and Ukraine, and to identify the potential steps that can be taken to improve the ADHD recognition in both the countries. An analysis is retrieved from the 18 PubMed articles, NICE guidelines, and NIMS guidelines.
This chart shows the prevalence and statistical charts. There are three types of ADHD: ADHD-I, inattention; ADHD-HI, which is hyperactive impulsive; and ADHD-COM, which is combined. As shown in the chart, the ADHD ratio is higher in males as compared to females in both the countries, which is further explained in the next slide.
So as shown in the previous slide, the comparison of the ADHD symptom subtypes in India and Ukraine. So in India, the prevalence of symptoms among all the ADHD types, males were significantly more affected than females. So in the bivariant analysis, students who reported symptoms of ADHD combined type had significantly higher odds of poor academic performances, that is, failure in subjects per year, alcohol abuse, tobacco abuse, suicidal attempts, suicidal thoughts, contact and non-contact sexual abuse. Whereas in Ukraine, the screening prevalence rate of ADHD behavior was 19.8%, and the highest ratio was seen in the hyperactive impulsive type, that is 8.5%. Teachers rated children with ADHD as more hyperactive and inattentive, but not only the hyperactive impulsive subtype was rated the oppositional than non-ADHD students. The first subtypes was less academically proficient and socially adept, but less likely to have behavioral problems. The combined subtype was the most behaviorally disruptive, and their fathers were more likely to be aggressive and abuse alcohol. The hyperimpulsive subtype had also problems with the disruptive behavior, but were less socially impaired.
Speaking about the comorbidities, there are three basic types: developmental, psychiatric, and medical. Developmental includes intellectual disabilities, learning disorders, organ spectrum disorders, etc. Psychiatric comorbidities include conduct disorder, mood disorders, psychotic disorders, substance use disorders, etc. And the medical comorbidities include diseases such as epilepsy, seizures, malnutrition, thyroid abnormalities. So after we detect these possible comorbid conditions, if the clinician is not trained or experienced in making the diagnosis or initiating the treatment, the patient should be referred to an appropriate subspecialist to make the diagnosis and initiate treatment as soon as possible, just to make sure there aren't any adults.
So talking about the differences in diagnostic approaches for ADHD. So in Ukraine, according to the guidelines of European Association, ADHD diagnosis is made at the end of 4 years. Whereas in India, according to the Indian guidelines, ADHD diagnosis is made at the end of 6 years.
Talking about the common diagnostic instruments, in Ukrainian guidelines, PSC-17 and SDQ is used in children starting from the age of 4 years. Conners rating scale or ADHD rating scale is used from the age of 6 years. And the same instruments are used in Indian guidelines as well. But this diagnosis should not be solely made on the basis of scales. And other scales such as questionnaires, Eichenbach's child behavior checklist, CGI, CGAS scales can also be used.
So talking about the treatment of ADHD, the treatment is similar in both the countries, but the first line treatment differs as the drug methylphenidate is only available in India. In Ukraine, it's not available in the pharmacies due to the features of laws in Ukraine. Therefore, there is inconsistency of the legislative framework with the therapy standards approved by the Ministry of Health of Ukraine and international guidelines. Other drugs are used such as dexamphetamine and lisdexamphetamine. Tricyclic antidepressants aren't used because of their side effects in the cardiac system. So, as a first-line treatment in Ukraine, the second-line treatment is used as a drug, atomoxetine.
Speaking about the second-line treatment, non-stimulants are mainly used, such as the atomoxetine, which has side effects of tachycardia, growth retardation, clonidine, which has orthostatic hypotension as the common side effect, and guanfacine. But clonidine and guanfacine are not available due to side effects. And among non-stimulants, selective norepinephrine reuptake inhibitors, atomoxetine, and selective alpha-2 adrenergic agonists have demonstrated efficacy in reducing the core symptoms among children and adolescents. Norepinephrine reuptake inhibitors and alpha-2 adrenergic agonists are newer medications. The second-line treatment in Ukraine involves atomoxetine and guanfacine, which are the non-stimulant drugs with most convincing evidence. Trials have directly showed the clinical important benefit of guanfacine. The committee recommended that in children aged 5 years and over, either drug could be offered after intolerance to stimulants, which are methylphenidate and lisdexamfetamine. Because of no evidence, guanfacine is not licensed for use in adults, and the committee recommended atomoxetine for adults with intolerance to stimulants.
So as a third-line treatment, non-pharmacological interventions are used, and there are several methods such as environmental modification, parental training intervention, cognitive behavioral therapy, cognitive training, and psychosocial intervention.
To conclude this session, this comparative study provides additional evidence regarding the diagnosis and treatment, and evidence is clear with regard to the diagnostic criteria and procedures required to establish a diagnosis, identify the comorbid conditions, and treat both psychosocial and pharmacologic interventions. The steps required to sustain appropriate treatments and achieve successful long-term outcomes still remain challenging. So, thank you.
Thank you for your attention.
Thank you very much for your message, for your recording video, and for very interesting topic. So please, who would like to ask some question? Please, referee maybe would like to ask something.
May I ask?
Okay.
The authors of the report mentions that the age of diagnosis in Ukraine, the age that diagnosis should be made is 4 years, and in India it is 6 years. So there is a difference. And my question is, did the authors of the report check what is the age in European or American guidelines, and did they compare these guidelines, local Ukrainian and Indian, with other guidelines?
Okay.
Thank you for your question, doctor. So yes, we compared the American guidelines, that is the NIMS guidelines, and for India, we compared the latest Indian guidelines. And according to that, the age of onset is 6 years for the diagnosis in India, and for Ukraine, it's 4 years.
Yes, and speaking about the European countries, it ranges between 6 to 18 years, which is the minimal time.
Yes, doctor.
Okay, thank you.
Okay, any other questions for our reporters? So please ask. Natalia, maybe from you.
No, I have no question.
Okay. Okay, thank you very much. And we would like to introduce next participant. It is students Bogomolets National Medical University, Sophia Fritsch. Hello. Nice to hear you. Nice to see you.
I have a very good connection today, and if it's possible, I would like to give my presentation by person, not in the report, because such an opportunity, I think we could use it.
Okay, we ask now technical assistance. Sophia would like to introduce by yourself now without reporting. So is it okay? Yes, no problem. Sophia. So, okay, so please try to do that.
Okay, I have a question for you. Do you see my screen? Oh, I'm sorry. My screen, and
yes, please make a full monitor, full screen, please.
Yeah.
Make a full screen.
And do you see how the slides are changing? Yes, we can see. Super. So I will start my message for today. First of all, my name is Sophia Fritsch, and I'm very grateful for such opportunity to present our research dedicated to common problems of breastfeeding for mother and children.
Nowadays, this problem has a great actuality because breastfeeding is one of the most effective ways to ensure child health and survival. Because of breastfeeding problems, 2 out of 3 infants are not exclusively breastfed for the recommended 6 months, and this rate has no improvement in 2 decades. Breastfeeding is very beneficial for both infants and mothers. You can see all the benefits here on the slide. I won't stop on them because we have time limits. So the aim of our research is to identify the main problems that occur during breastfeeding. And for materials and method, we had interviewed 144 breastfeeding mothers of different ages, family status, and breastfeeding experience. Information was collected on all aspects related to breastfeeding, such as physiological aspects, psychological aspects, techniques, breastfeeding problems, and how mothers are dealing with them. From the literature, we know that the American Academy of Pediatrics and the World Health Organization recommended breastfeeding for at least 6 months with continued breastfeeding along with introduction, appropriate complementary food for up to 2 years old or even longer. But most women stop breastfeed their baby in age less than 6 months old, and many never start at all. The reason of such statistics are inconvenience or fatigue associated with breastfeeding and concern about milk supply. Here we can see the results of our research that are showing why breastfeeding lasted less than 1 year. We can highlight that most women are suffering from lack of lactation, it's about 45%, and many of them faces problems with physiological and psychological discomfort. The next reason is returning to work or school, long PrEP or mast disease or medications that are incompatible with breastfeeding. In total, 20% of women who were interviewed finished their breastfeeding journey before than 1 year. In the first few weeks of life, breastfeeding should be on demand, so when the baby is hungry, which is about every 1.5 to 3 hours. But as newborn gets older, they will nurse less often and they will have more predictable schedule. Some may feed every 90 minutes, when the other might go to 2 or 3 hours between feeding. Our research results have shown that mothers with children of all ages prefer to feed their babies on schedule, but there are still moms that nurse their babies on demand. Statistics have shown that it's from 14 to 17% of mothers with children of different groups. Here, I'm sorry. Then most problems associated with breastfeeding are due to incorrect attachment or position. So now we are going to discuss how it should be done. Here we can see a very short abbreviation that contains most important points of right attachment, and it sounds like latch, where L is for lip length out, wide, giving mouth to accommodate areola and nipple. The A is for asymmetrical latch, where more areola is visible above the baby's top lip. T is for tummy to tummy, when baby's ear, shoulders, and hips are in alignment, so mother's and baby's tummies are touching. C is for chin touching breast. Nose is free in the suffering position so baby can breathe freely. And H for have a listen and watch. Active sucking and swallowing indicate milk transfer. You can see all these points demonstrated on the illustration below. The second point is position. I might say here that any position that is comfortable for the mother and child and allow effective breast milk transfer is acceptable. Effective positioning and latching are essential for successful breastfeeding and help the infants to suck effectively, assure effective breast milk transfer, stimulate, build, and maintain the mother breast milk production, help to prevent many breastfeeding problems such as sore nipples, mastitis, low breast milk supply, and poor infant weight gain. Our research has shown that 40% of mothers usually change breastfeeding positions, and most popular is laid back and cradle position. Here you can see a diagram that shows which position that mothers prefer during breastfeeding in the different age groups of their child. So now we are going to discuss main problems that occurs in breastfeeding journey for mothers, infants, and both of them. Maternal problems are usually around some medical disease, medical conditions such as hormonal disorders that are uncomparable with lactation, maternal use of medications, breast surgery, or some nipple condition. For infants, there are also just medical issues such as prematurity, ankyloglossia, neuromotor delay, sucking or swallowing disorders, malformation, and neonatal jaundice. Mothers and infants are all problems are around the connection for mother and children, so delayed breastfeeding introduction, anesthetization, separation of mother and infant, poor latch, and weaning. So, breastfeeding problems could be divided on three main parts. First one is inadequate milk intake, and it also could be separated on 3 points. Inadequate milk production, poor milk instruction, is specific infant factor, and milk oversupply. The next point is nipple and breast pain. After insufficient milk intake, nipple and breast pain are the most common causes of premature discontinuation of breastfeeding. There are such problems as nipple injury from inappropriate latch or trauma of breast, nipple vasoconstriction, engorgement, plucked ducts, nipple and breast infections, and nipple dermatitis and psoriasis. Out of the second group, the third one comes and is breast infection. Such states as lactational mastitis, breast abscess, candidal infection, bloody nipple discharge. You can see it in the lowest picture. It's normal for the few first hours of breastfeeding, and you can see picture of pink breast milk. It means that it contains mother's blood. Here you can see our research results that are showing the most common breastfeeding problems that mothers has with children of different age groups has faced during their breastfeeding journey. So there are such points as nipple pain at the beginning of breastfeeding, nipple injury, lactostasis, and lactational mastitis. I would like to pay you attention that only 8% of women out of 37% of women who were suffering from lactostasis gained lactational mastitis. It's also poor latch, infant refuse, and milk oversupply. There are also such points as weaning problem and other problems that hurt the lower percent. Based on the analysis of the data, we can make a conclusion that during breastfeeding, mother and infants faces huge amount of problems. Due to problems with breastfeeding, 20% of mothers finishes it before 1 year of their child. First main group of breastfeeding problems is inadequate milk intake. And third group is lack of milk supply or hypolactation. It's 45% of women who stop nursing because of it. The second group is physical and psychological discomfort for mothers, is 31%, and for children, it's infant refuse, it rates at over 12%. Other big group is nipple and breast pain and nipple injury. For nipple and breast pain, we're suffering 52% of mothers, and nipple injury were at 45% of all age. Nipple pain is more common problem in group of mothers with children less than 6 months old, is 60%, and from 6 months to 1.5 years is 61%. Nipple injury occurs in group of mothers with children from 6 months to 1.5 years old, it's 48%, and from 1.5 years to 5 years old is also 38%. Milk oversupply was more common in group of mothers with children older than 6 months old, is 40% of mothers, and from 6 months to 1.5 years old is 39%. Other part of this topic is different health issues for mother and infant, but they're much more rare. All of those problems are significant, but most of them occur due to incorrect attachment and latch. So it proves the importance of education and supporting mothers during breastfeeding to prolong breastfeeding and make it more convenient for mother and children. Here is literature, and thank you for your attention.
Okay, thank you so much for interesting presentation. So please, who have a question for our reporters?
Can I ask?
Yes, of course, please.
Really, it's interesting report, but I can't understand. It's your own research or it's literature?
Yes. Yes, it's our research. I will come back for our presentation, and I had given some common facts from very representative uses of material and compared it with our research. So it's mentioned all above, and we were comparing literature with our research. It was 144 women that we had interviewed of different ages, of women of different breastfeeding experience of these children with different age, and we had made all our conclusions by us own. This research was given in Kyiv in the sixth clinical hospital in Kyiv here.
Okay, thank you. It's very interesting, really.
Okay, thank you. So any other questions? Sophia, please switch off your presentation. Okay, any another question? So you can, anyone can write this question in the chat, or you can ask a question by yourself. Anyway, it's okay. Okay, we can see the question for you, Sophia. Which problem is the breast could be up to 5 years after birth?
Okay. It could be a wide range of problems actually, but the main one that could occur is, of course, associated with breastfeeding. It's nipple pain or breast pain and breast infection. This group of problem is most common for all ages of mothers and babies who they're feeding, because wrong hygiene and wrong latch, wrong position can lead to some damage of nipple, and it will go to infectional disease and could lead to lactational mastitis, breast abscess, or even some fungal infection.
Okay, thank you very much. Any another question or comments? No? Okay. Sophia, thank you very much for your report. And we would like to ask and introduce our next participant, Denis Ternovoy. Denis today present a university from the Sumy. Hello, Denis, do you hear us? Yeah.
Can I also share my presentation?
Yes, of course. Yes, you can share.
Yes, okay. Can you see?
Yes, everything okay. So
and the slides.
Yes, everything okay. Yes, you
okay.
Can start, please.
I want to mention before the presentation that all the data which we got it before the war situation, and I will make a point about it in our conclusion. So basically, our topic, me and my teacher, it is the immune response to allergens in children, because it's a very interesting topic, especially for me as the medical student, because we will take a point about the cytokine, the transfer factors. When we study as the students the allergy reaction, we study in the normal state of the body. But we should not forget about some cases which are not common for a lot of people. So that's why we took the topic who is bound with allergies in the children. Also, the one main point of that, as I mentioned before, is the cytokines. When we study basically the anti-inflammatory structure of the allergy. But the aim of our work, it is to study the cytokines 1, 6, and 10, because they play a role in the first step. It is the pro-inflammatory steps And if we won't have enough of cytokines, the anti-inflammatory stage will occur, but it won't finish, and the inflammatory process will take for a long time. Basically, we will experiment it on the children in the hospital. We took the two groups of children. The first group, it is the children with the allergy. Should note that during the remission state, and the children without the allergy. So the allergy, it was like for the dust, for the cat hair, for the pollen, and with the hay fever. Our procedure, we did the test, it's named the skin test, to basically maintain the allergy reaction. And we use the immunoassay to find out the processes. And as we saw, there was in both children with the allergy and without allergy, the production of the cytokines 1, 6, and 10. A lot of people know that interleukin-1, it is the fever interleukin, but not a lot. Students know that the interleukins also play impact in the production of the fever, and the interleukin-10 take part in the MHC2. We found out that both cytokines, they producing in the both type of children of the groups, but the main interesting fact, there was the problem with phagocytosis. So like there is patients with allergic diseases, there is the 2-4 times lower than in like healthy children. And we took it in the like main part in our conclusion, because honestly, for the children with allergens, it's very hard to fight against diseases during the immune responses. And as medical students, as a doctor, at that time, we, as our conclusion, made the part that the children should have the rational nutrition, well balanced with vitamins and with outdoor walking. But unfortunately for Ukraine, it is very hard time, even though I'm not the citizen of the Ukraine, but I know the problems because I was in Ukraine the first time of the war. And because of that, as the future doctor, I need to say the recommendations. So the recommendation, basically it is the refreshing of the room, especially the type of the location of Ukraine. It's very necessary. The second tab, it is the hardening of the children, because when the hardening is occurring, the immune system is like getting better and better. And the main fact, even though it is the diet, even though there is a problem, maybe the problem in some regions with the drugstores, we should find the vitamins even in the daily products. So my recommendation is eat the citruses, because of vitamin C. Vitamin C is like the very good, it has the very good oxidation process, and we know that it make the proliferation of the T and B lymphocytes. Also, do not forget to eat the fishes, which give us the omega. And basically, if we cannot go out, do not forget to turn out your blind to get enough the sun for the vitamin getting during the daily. So thank you for your attention, and I hope the Ukraine will stand and everything will soon better for the kids of Ukraine. Thank you.
Thank you very much for your presentation. So any question for Dennis? Any question, please? Very interesting, relevant. Yes, you have a commentary. So, Olena.
Yes. This report is very scientific. I want to clarify some information for us. So, as we understand, the interleukin first, 6, and the one more that was done, these are interleukins that are responsible for T helper first time inflammation, antimicrobial, anti-infection inflammation. And allergic process, this is T helper 2 inflammation. So maybe that's why your scientific work has showed this, that healthy children who are not allergic, they have more prevalence of these interleukins, T helper 1 interleukins, and which are responsible for infection process. And they have lack of this anti or pro-inflammatory interleukins. So maybe stimulation with some microbial diversity and maybe vaccination and a lot of contact with microbes like animals, with other children will improve such interleukin immunologic background of these children. Thank you. So maybe
yes, madam. Okay. I understood. Yeah, it can, but we should not forget that the allergy is like very serious condition, because even though if there will be the trigger of the allergic reaction, it can be very dramatic cause. It can affect the very dramatic cause. So that's why we do not want to harass the children. And as I mentioned before, the process of hardening, even the right nutrition, it won't make any trigger process, and it's like hard but very useful way to help the children. Thank you, madam.
Okay, thank you. I hope you will continue this very interesting study. Thank you.
Thank you, madam.
Okay, any another question? No question. So, Denis, I would like to ask you, now it is a presented theory about necessary addition some allergen in the first years of old, for example, some nuts or milk and so on. So what do you think about that? Is it really help for children to have a less level of allergy in future or not? What maybe you can comment something about that?
You mean like to give early milk to like
nuts, milk, and so on.
Okay, madam, I understood. I think it's not very necessary because still, as I remember, I was reading the topic. It's still not very qualified. And for example, we have the type of allergy with the cat hair, and it's very like dangerous for the kids, especially if the kids and like in the embryo, because cats has the very problematic situation with the toxoplasmosis, as I remember. And the toxoplasmosis, it can lead to the death, it can lead to encephaly. And think about your question, honestly, madam, I'm a young generation, but I will like lead the books of the pediatric and give their nutrition as the doctors think. I don't think that the introduction of the early allergen will like make a very good impact for all children, because each children has its own immune system and it can sometimes make some elevations. So yeah.
Okay, thank you so much. Okay, any another question or comments? No? Okay, thank you so much. And we would like to introduce next our reporters. So it is a student, 6 years old, sixth course of Bogomolets National Medical University, Ruhi Kolte. Hello, do you hear us?
Hello.
Hello.
Good morning, ma'am.
Yes,
and
good morning.
Everyone.
So please introduce your report.
let me introduce myself. I'm
Yes, you can.
I'm from 6th year Bogomolets National Medical University, Ukraine. And
Please
my
share your
guide,
presentation.
Dr. Anna, thank you so much for introducing to such a good case. Can you see my screen?
Yes, almost. Yes, yes. So please do full screen of monitor. Like start the presentation slideshow. Yes, okay, everything okay. Please start.
The title of my case study is Post-COVID Patient with Erythemal Nodosum. Let me introduce about it. What is it? Erythemal nodosum is an hypersensitive reaction, which is 4th type delay. Erythematous tender nodules on lower limbs, mainly. The most common form is paniculitis. The etiology is unknown. To rule out the underlying disease is imperative before diagnosis erythemal nodosum. Erythemal nodosum can be the first sign of systematic disease caused by infection, inflammatory disease, or cancer or induced drugs. The most common identifiable causes are streptococcus infection or tuberculosis or sarcoidosis or Behçet disease or inflammatory bowel disease, drug-induced or pregnancy. Despite the fact that cutaneous manifestations of SARS-CoV-2 infection have been increasingly identifiable over the course of pandemic, few cases of EN have been reported. In this case study, the patient was diagnosed by erythemal nodosum because of the COVID-19 infection. The purpose of this study was to report the importance of clinical awareness of potential association of COVID-19 with the classical clinical presentation of EN, and to manage even if it is caused by virus, which is SARS-CoV-2 virus. Let's start with the case description. A 17-year-old girl was admitted to the hospital with complaint of painful rashes on her legs, which was painful by pressing, and the rashes was also seen in hands, and there was rise in temperature. She was found COVID-19 positive 2 weeks before the admission. There was no family history, vaccination was completed till the age, and no similar complaints in past. First visit to clinic. The girl was hospitalized from 25th Jan 2020 to 8 February 2022 with complaints of rash on her legs, hands, and painful area at the site of rash, and increased body temperature. When there was blood analysis done, it was normal. CRP was positive, and IgG for COVID-19 was positive. In the second visit, the laboratory and instrumental examination was performed, where CBC was normal, anti-streptolocin titer was normal, rheumatoid factor was normal, C-reactive protein was high, IgG was positive, D-dimer positive, fibrinogen normal, prothrombin normal, total protein was normal, ALT, AST was normal, glucose was slightly low, creatinine was normal, EGG perform was normal, and an ultrasound of abdominal organs was increased and change in the shape of gallbladder. Treatment received by the patient was diclofenac 5 mg intramuscular injection twice a day, dexamethasone tablet 1 gram per day, loratadine tablet 10 mg once in a day, and ceftriaxone 1 gram once in a day. The outcome and follow-up of the patient was painful rash was almost completely disappeared at the time of discharge, and the patient was hospitalized for 2 weeks. Conclusion, we present here a 17-year-old girl patient with erythemal nodosum. This is due to an acute COVID-19 infection. This case is typical clinical presentation of COVID-19 infection confirmed by IgG test. It is necessary to make a differential diagnosis like throat swab, CT scan, stool test, and much more to rule out the causes of streptococcal infection or tuberculosis or sarcoidosis, inflammatory bowel disease, drug, or pregnancy. As you can see in the laboratory and instrumental test, the COVID-19 was positive and C-reactive protein was high. So there was no need of skin biopsy performed because of high suspicious clinical test seen. Learning point, in this case, there was different etiology not seen because of rule out of CRP and IgG test. It is necessary to make a differential diagnosis with additional examination to correct the interpretation of disease and give proper treatment. And EN is a common cutaneous manifestation till date, and there was no pathology and no etiology. It's unknown. The references which I use were these. Thank you for your attention.
Thank you very much for your report. So any question for our students of oral faculty? Any question about case reports? So you can write the question in our chat, or you can ask our students by yourself. So any question? No question? Okay, thank you very much.
Can I ask a question?
Yes, please, Kalagi, yes.
Okay, so can you tell me what is the prevalence of the erythema nodosum in Ukraine, if you know about it?
In Ukraine,
Do you hear us, or something happened with the connection? Hello? Hello?
yeah, ma'am. Can you hear me?
Yes, so we can hear you now. So can you answer for Kalagi?
Yeah, mostly the etiology seen of EN is streptococcal infections. But in this case, as it's kind of unique because of infection of COVID-19, the EN was seen. And the duration of the treatment received was almost 2 weeks from the date of admission.
Okay, thank you very much. Any another question, comments? No? Okay, thank you. So, and we would like to introduce our next participants. So we have some changes in our schedule. So next students can be Dmitro Nikulin, but we cannot see now in the chat. So we are waiting for when he join, and also one student with report Wilson disease in the children, Mohammed Sayem, unfortunately cannot join for us due to problem with health. So now we would like to introduce our next participant, Margarita Vlasik, with a report about polycystic ovary syndrome in adolescents. Margarita, do you hear us?
Yeah.
Yes, okay. So please start your report.
Yeah, my report topic is polycystic ovary syndrome in adolescents. And next. Purpose, find out how, okay, introduction. Next, please. Okay, introduction. Polycystic ovary syndrome is an endocrinological disease associated with disruption of the hypothalamus, pituitary gland, ovaries, adrenal glands, nucleus. It ranks first among endocrine diseases in women of reproductive age. Next. Purpose: find out how hormonal changes in polycystic ovary syndrome affect the general condition of women. Consider a set of measures to correct menstrual dysfunction. Relevance: today, the causes of development of polycystic ovary syndrome are not certainly known, so the treatment is individual and does not give 100% recovery. According to statistics, about 15% of adolescents in the world have polycystic ovary syndrome, and 65-70% of all causes remain undiagnosed, which leads to involuntary infertility in 70-80% of all women. Next. Main part, a little bit about history of this disease. The syndrome of polycystic sclerosing ovaries was first described by American gynecologists Dr. Sain and Leventhal in 1935. Sain-Leventhal syndrome in women who were overweight and had amenorrhea and mescalizing symptoms. The disease may be consequence of insulin resistance, congenital insufficiency of the adrenal cortex, disorders in the hypothalamic pituitary system, infectious diseases, etc. According to the classification, the male type: menstrual disorders, oligomenorrhea with transition to amenorrhea, polycystic ovaries in 23%. An increase in body weight in 35-60% of patients because of the excess testosterone, estrogen, and background insulin. Body mass index can be over 30 points. Emotional state disorder and reproductive function disorder, lack of ovulation, impaired glucose tolerance in 30-40% of all women patients. Next. Diagnosis. Diagnosis of polycystic ovary syndrome includes several laboratory tests. It's luteinizing hormone, androgen synthesis from cholesterol in ovarian theca cells, follicle-stimulating hormone. Follicle-stimulating hormone, determination of 3 testosterone index, total testosterone hormone, globulin testosterone. If luteinizing hormone predominates over follicle-stimulating hormone, then the ovaries produce androgens. Instrumental studies are also carried out: ultrasound diagnostics of the pelvic organs, measuring the size, shape, and the structure of the ovaries, and the thyroid gland with determination of thyroid-stimulating hormone, antibodies to thyroglobulin, antibodies to peroxidase, adrenal glands with the detection of 21 hydroxylase deficiency. Also, tomography presents of absence of a pituitary and brain tumor. Then magnetic resonance imaging for more details to assess glycemic status. Next. And there are also therefore clinical variants of polycystic ovary syndrome. First one is phenotype A. It's the causes hyperandrogenism, anovulatory cycle, and polycystic ovaries. Phenotype B, hyperandrogenism and anovulatory cycle. Phenotype C, hyperandrogenism and polycystic ovaries. Phenotype D, anovulation and polycystic ovaries. When performing an ultrasound examination, the presence of about 20 follicles with a diameter over 4-9 millimeters and an ovary volume of 10 millimeters, in which there is no dominant follicle, is the basis for establishing the diagnosis of polycystic ovary syndrome. Next. So the main thing in the treatment is a multidisciplinary approach. The regime of work and rest, the normalization of body weight, and the appointment of oral contraceptives. Oral contraceptives are given in most of the forms of polycystic ovary syndrome. It should be remembered the development of endometrial cancer is 4-5 times higher in women with polycystic ovary syndrome, 95% adenocarcinoma. Next. So the clinical case of polycystic ovary syndrome. Next. A 15-year-old patient complained of acne, excessive hair loss on her head, and the appearance of excessive male-type hair growth during a year. From the anamnesis, menstruation has been regular since the age of 12. She consulted a doctor, and the ultrasound examination of the adrenal glands and pelvic organs was performed without structural changes. Next. So you can see here the analysis for hormones. Analysis shows that dihydroepiandrosterone sulfate increased. Total testosterone is normal. Dihydrotestosterone increased. These are the main hormones we need to check. Diagnosis: congenital adrenal insufficiency. It was prescribed the treatment, dexamethasone tablets, 5 milligram once a day, every other day for 3 months. So you will ask me, what the result of this treatment? There is no result. Please, next. The patient condition did not improve because of incorrect diagnosis. Next. So she changed the doctor and she went to consult the doctor, and on examination, reduced nutrition, excessive male-type hair growth, acne on face, back, shoulders, hair on the head with a greasy sheen, scars. Analysis for dihydroepiandrosterone sulfate increased. Total testosterone is normal. Dihydrotestosterone elevated. So you can see that analysis for hormones are before treatment of dexamethasone and after, it's the same. The analysis also revealed vitamin D deficiency. The external genital organs are developed correctly with ultrasound of the pelvic organs without structural changes. So the doctor prescribed treatment like anti-androgens and estrogens. It's called Diana 35. Next. So the results of treatment with anti-androgens and estrogens, Diana 35, examination after 3 months, acne is less on the face and back, hair in the groin and on the inner surfaces of the thighs is thin and sparse, enlargement of the mammary glands, examination after 6 months for this treatment, absence of acne, female type hair, enlargement of the mammary glands, analysis, cortisol in daily urine is normal, dihydrotestosterone is in the norm, vitamin D is in the norm, 70 hydroxyprogesterone is in the norm, dihydroepiandrosterone sulfate is in the norm, cortisol in the norm, the adrenocorticotrophic hormone is normal. So you can see after the treatment, all hormones become like normal. Currently, the patient is undergoing treatment until the planned pregnancy. Next. So the conclusions, so the polycystic ovary syndrome is an endocrine pathology in women of reproductive age. Timely detection and early treatment can normalize the psycho-emotional and hormonal background of patients, preserve the ovarian follicular reserve, and prevent infertility. Yeah, thank you. That's all.
Thank you very much for your interesting presentation. Really very important topic. Okay, any question, please, for Margarita? Any question from our referee? Or maybe
yes,
from
doctor. I have one question.
Yes, please, Kalagi.
Okay, so is it possible to reverse the polycystic ovary syndrome? And if the answer is yes, then how long does it take to reverse the PCOS symptoms?
Not in all cases you can recover from the syndrome. It can be just like symptomatic treatment because it's syndrome called this disease. It's not can be all cured.
Yes, thank you so much.
Okay, so any another question? Maybe from our teachers? Any question? Maybe any question somebody would like to write in the chat? No?
What was the duration of treatment? It's for me?
No, it's for previous reporters. Okay, no questions. Thank you very much, Margarita. Thank you for your interesting presentation. And we have another reporters, and we would like to introduce a student from the
Dnipro Governmental Medical University, Dmitro Nikulin, with a presentation which named 18 disorders associated with, again, in children with obesity. So we have a video report about this. We have video presentation, and then we can ask the question. I know that unfortunately not very good connection, but Dmitro now joined for us. So first we can see presentation.
Dear organizers of the conference, let me thank you for the invitation and present a report on the topic Eating Disorders Associated with CNV Task 2 R38 in Children with Obesity. Targeted applied research work of the Department of Pediatrics 1 and Medical Genetics of the Dnipro State Medical University. Prediction of the development of childhood disease associated with civilization. According to the definition of the World Health Organization, obesity, particularly metabolically unhealthy phenotype associated with the formation of insulin resistance, is a global epidemic of the 21st century. The analysis of previous gene-associated studies allowed us to identify the leading influence on the risk of obesity formation of the beta test receptor gene, TAS2R38. Purpose of the study to determine the contribution of single nucleotide variants gene test to receptor member 38 to the development of eating disorders in metabolically unhealthy obesity in children. Under our supervision, there were 210 children aged 6 to 18 years. The main group was formed by 128 children with metabolically unhealthy obesity according to the criteria IDEFIX 2014. The control group was represented by 82 children with metabolically healthy obesity. The sample population of children underwent genomic sequencing consisted of 52 children and did not differ from the gender population in terms of the main criteria. Let me not read the research methods presented on this slide. In the comparison groups, children with metabolically unhealthy obesity were characterized by high physical development, body fat mass, abdominal obesity, and high blood pressure. In a laboratory examination in children with metabolically unhealthy phenotype, there was a 9-fold increase in insulinemia and 2-fold increase in leptin and type 6 interleukin and dyslipidemia. The greatest contribution to the formation of metabolically unhealthy obesity is made by fasting insulinemia, steatohepatosis, and extreme type of obesity. Analysis of food diaries in children showed a positive correlation between daily non-consumption of fresh vegetables and the formation of MUA with the prognosis factor 2.7. Whole genome sequencing shows that the greatest risk of the development of metabolically unhealthy obesity is the CG genotype, RC713598 of the beta test receptor gene, which is associated with an external type of eating behavior. Conclusion. Types of eating behavior in children suffering from metabolically unhealthy obesity are associated with TAS2R38 gene genotypes and require personalized nutrition modification. Correlation with the formation of MUA has an external type AD, significantly more often diagnosed with the highest degree of deviation in eating behavior in the CG genotypes of CNV, TAS2 are 38, RC 71, 35, 98. Thank you for your attention.
Thank you very much. Dmitro, do you hear us, I hope? Thank you very much for presentation. Dmitro, do you hear us? Maybe you can tell something. Maybe we can check the connection. Dmitro? Чутно, okay. We can see answer in the chat. So maybe some of you would like to have a question for Dmitry.
May I?
Yes, please.
I have a question. Can this polymorphism be found in healthy people? And if yes, is that group of people are a risk group, and should they use some recommendations or interventions for eating some food recommendations?
Healthy eating.
Yes, healthy food.
Okay, Dmitry, you can write in the chat if it is difficult to tell. Dmitry, do you understand the question? Dmitry, do you understand the question? Так. Так, пишуть, що поганий інтернет. Так. We have a message from technical support that he has a very difficult with connection. Так. Okay, we can hear answer. It is a recommendation for decrease the level of some foods. Okay, and individual therapy. Гірких продуктів. Okay, another question? So Dmitry, as I understand, it is so big work. So maybe it is work of some team, students team, maybe. Так, healthy patient or healthy children also has a genotype CG. Okay. Any another question for Dmitry? Any another question for Dmitry? No question. Okay. So thank you very much. We have to calculate now some marks, so some your results. So who would like to tell something about this part of conference? So please tell, and we after 5 minutes we can tell about the total results and about the place for our students. So please, teacher, somebody from reference, you can say some comments about this part of conference, please.
May I?
Yes, of course, please.
It's a pleasure to be here with you, of course. I think all of us heard a lot of interesting, useful, and new information. Today, especially, I think, was very interested to hear about the polycystic ovary syndrome. Very interested to hear about common problems of breastfeeding. I think it's my leader. And of course, interested information about post-COVID cases, about eating disorders. And I think the work of young scientists is very important. And I wish good luck to all students and keep on working. Thank you.
Okay, thank you very much. Who also would like to say, maybe Olena Volodymyrivna, maybe you. Oh, okay.
May I?
Yes, of course, please.
Thank you very much. Thank you very much for all presenters for very interesting and useful presentations. We as jury assessed these presentations following some criteria. Those criteria were the study design, practical meaning, and the clearance of answers for questions, and the quality of presentations, and originality of the topic. So we all gave our marks, and I think we will calculate them, and our beautiful moderator will present the summarized results, and we'll have first, second, and third place of the participants, among the participants of our conference. Thank you very much again for this for your interesting talks, and I wish you further successes.
Okay, thank you very much for good words for our participants. Yes, 2 minutes yet for calculation. Our technical support almost already done. So maybe somebody also would like to say something. Maybe some students would like to say. Please do. Yes, please.
I want to say that I thank everybody, and especially our young scientists, our students, for their participation in this very interesting conference, but in very not easy, very difficult circumstances for all of us, and even for those students who are now not in Ukraine, but a problem with connection. These all are difficult issues, but still everything was good, was in very good quality. So thank you very much to everybody.
Thank you. So any words maybe from our students, our participants? So already I have information from our technical support. So all marks are calculated already. So referee, please check in the group. Okay, so today we have 6 students who joined to us, who participate in this section. And we have 1 first place, 2 second placed, and 3 third placed. So I would like already to tell about results. So referee, can I tell results, or maybe some of you would like to tell that? Evgeny Olegovich, you would like to tell, or I can do that?
I give this honor for you.
Thank you. Okay. So we have results. Third place received 3 students: Denis Ternovoy, Ruhi Kolte, and Dmitro Nikulin. So our congratulations. Second place received Sofia Fritsch and Kalagi and Banshi. And first place received Margarita Vlasik. So thank you very much for every student who joined to us, who present very interesting topics, different topics, very important topics for study. So we would like to say, please don't stop. So science never stop, and please don't stop, and don't worry about maybe not good results for you this time, because it is every time we study and also teachers study with you to do very well next time. So Everything have been very good, I think. Thank you very much. If you have some question or maybe some comments from students, please do that.
I want to say a real thank you. I was glad to participate in this conference.
Okay, maybe Ruhi Kolteo, Kalagi, you would like to say?
Yes, so thank you, doctors, for giving us a great opportunity for this conference, and I wish that Ukraine will win this war, and Slava Ukraina.
Doctor, I'd like to say that I'm really happy I got this opportunity, and thank you so much for giving this platform, and we're always with Ukraine.
Okay. Okay, so now we can send these results in the chat. So who cannot hear or maybe difficult with join to us, you can hear in the chat. And the certificates and diploma of your place will be a little bit later. So you can receive it on your email or in the group of our Telegram chat. Thank you very much. Have a good day and take care. Slava Ukraini.
Thank you so much, Slava Ukraina.
Yes, goodbye.
Goodbye.
Thank you, Doctor.